And so we are going to be covering saving all the community cats, options for healthy outdoor cats. And we're going to have a group of presenters today. We've got Christi Metropole, founder of the Stray Cat Alliance. This is about Christi. When Christi encountered a stray needy kitten in 1999, she was appalled to learn that few to no resources existed to help her, the cat, and thousands like them. As a result, she founded Stray Cat Alliance, and soon feral and free-roaming cats had found a formidable ally. Under Christi's unwavering leadership, hundreds of volunteers and scores of donors have since united to provide education, human power, and skills to Trap-Neuter-Return thousands of cats who need help. Under her astute direction, Stray Cat Alliance's dedicated network helps ensure a safer and healthier quality of life for often misunderstood and targeted feral, stray, homeless, or community cats that would otherwise survive and flourish. Christi is acknowledged as an influential and candid voice for those cats. She is the go-to source on the subject, and her opinion is sought by other humane proponents needing sound advice. She's frequently requested as a speaker on critical issues related to cat care and protection, laws regarding humane treatment, and human health-related concerns. Her experiences as a teacher and as a realtor have honed integral skills that help strategically steer the course and further development of Stray Cat Alliance. We also have in today's presentation, we have Anna Wong. Anna is the Return to Home Director at Stray Cat Alliance. She's working to help achieve a no-kill nation, one stray at a time, by implementing and running return to home programs in Southern California. Anna started out as an independent rescuer, helping other rescues and advocacy organizations address cat hoarding situations. She later moved on to Trap-Neuter-Return activities and then began focusing on animal welfare shelter reform efforts. As Stray Cat Alliance's Return to Home Director, Anna played a pivotal role in helping Long Beach Animal Care Services reach no-kill status, collaborating with the city to create best practice protocols and systems to ensure that the safety of community cats. Her passion for community cat welfare, both in the shelter and on the street, drives her mission to educate, empower, and support community cat caregivers, trappers, shelter staff, and animal advocates nationwide. We have Staycee Daines here with us today. Staycee has been a public servant in several private and municipal shelters over the last 2 decades, specializing in reducing euthanasia rates and improving shelter operations to better serve animals in its care, improve staff working conditions, and meet the needs of a diverse community. Staycee came to Long Beach Animal Care Services as its managing director in February of 2019. Prior to joining the City of Long Beach team, Staycee served as the animal shelter operations manager for the City of San Jose, overseeing an expansive operation that served over 1 million citizens and nearly 20,000 animals each year. Staycee enjoys spending time with her husband of 19 years, their 2 children, ages 13 and 8, and comes from a family of public servants and is the proud mother of 2 grown sons, both in public service, including the U.S. Marine Corps and U.S. Department of Forestry. She currently has 2 cats and 1 dog and foster animals for the shelter whenever she can. And so I'd like to welcome the whole panelist team here, and I'm going to hand the microphone over, I guess, to Christi.
Hi, everybody. Hi, Stacey, and thank you for having us today. I'm really excited about presenting some of the things that went on for the last 7 years at Long Beach Animal Care Services. And we believe that we can do it in Southern California, where there's more cats than bits and pieces of sand. We can do it anywhere. So again, my name is Christi Metropole, and I'm the CEO and president of Stray Cat Alliance here in Los Angeles. And I'm joined by Anna Wong, who runs our Return to Home programs, and Stacey Daines from Long Beach Animal Care Services. And we're going to be presenting Return to Home for community cats. We're going to talk about as a public-private partnership to provide safe outcomes for community cats. We know Return to Home programs are still unfamiliar, and we want to take this opportunity to detail the incredible positive impact Return to Home programs, which there are many, and our particular partnership have on the lives of community cats. So, sorry, I got a lot of windows here open. So really, what is Return to Home? So probably a lot of you on this webinar, you might know, or you might have some ideas, but but other people might have ideas too. And one of my goals is to have our movement have shared vocabulary and shared definitions. So we're all talking about the same thing, because sometimes we're not. So these are types of programs: return to field, shelter-neuter-return, trap-neuter-return. A lot of you know in the West Coast, return to field, and a lot of you in the East Coast, like Texas East, call it shelter-neuter-return. I call it East Coast, West Coast. They're really all return to home programs, whether you're trapping a cat in a community and fixing them and returning them, or you're going to the shelter and fixing them and returning them. They're all return to home programs, because the idea is to sterilize the cats, make sure that they're in good condition, and you return them from where they came. So, and the fact is that not all cats want to live indoors in a home. Many healthy adult cats are thriving outdoors, and the outdoors is their home. Those unfamiliar with return to home programs often wonder which cats are eligible in a shelter to be returned to home. We believe, through our own work and speaking to people who run very robust programs around the country, that really 60 to 80% of healthy, of age cats should be returned to home in a shelter. A lot of people think, well, why that many? That's so many, and all the questions that follow. But many of these cats have caregivers and guardians, and they're thriving outside. This also really alleviates the burdens on shelter and shelter workers, and allows them to focus on saving the lives of the cats and kittens that can't be returned. There's a lot of cats and kittens, well, obviously young kittens can't be returned, so why not have the healthy cats returned and the shelter staff spend time on the other cats? Only a small proportion are not suitable. Sorry, everyone, it's very dry here in Southern California right now. We also know that this is a high percentage, and that not every shelter can return this many. So I do believe that every cat and every situation is an individual, and there is never a one size fits all. But this is a really good guide to most communities can return this many cats. Excuse me 1 second, I'm so sorry. Sometimes in underserved communities, resource challenged communities, the percentage of cats that are not healthy and thriving is higher. The stress, there's more density, there's less food. Sometimes you can't return 60 to 80%. So there's a lot of factors in why, who you return and what. But if the default is to return a healthy adult cat, regardless of temperament, and we'll talk a lot about that, it is not temperament, it is age and health, then your shelter can really focus on those cats that can't be returned. Resources are limited. So I'd like to introduce Anna Wong, who runs our Return to Home program in Long Beach and some other places too. Anna?
Thanks, Christi. This program has been incredible to run, and I hope that you guys are going to get a lot out of the presentation today. We've had some really great things happen in the 7 years that we worked with Long Beach, and it's been an absolute privilege. So to touch on what Christi's talking about for what we are looking for when we return cats, like she said, we are looking for reasonably healthy cats with good body condition and good information gathered at intake. That is so very, very critical. If your field officers are picking up cats too, then we want to make sure that they're doing the same consistency that your front desk is with getting information for these cats, because their safe return is of the utmost importance. They need to know the area that they're going back to. Cats that shouldn't be returned to home are obviously or clearly owned, declawed, critically ill, or are suspected of abandonment by their caregiver.
Implementing return to home program also allows the opportunity for targeted TNR. So we found that one of the greatest benefits of creating a return to home partnership is the ability to do return to home and targeted TNR. And this means more lives saved. In 2012, Michelson Found Animals and Stray Cat Alliance were looking for a shelter who would allow us to run a return to home program. And everyone turned us down. At that time, only 4 cities nationwide were doing return to home, and they were definitely called different things: San Antonio, Jacksonville, Albuquerque, and San Jose, which Staycee knows all about because Staycee was already running it. She was the first in the West Coast. And little did we know that Long Beach was looking to do some kind of return to home program, and we were just ripe for working together. And you'll learn more about how the targeted TNR, the returning a cat from a shelter and trapping the cats around there, is the targeted TNR, and that is your biggest bang for your buck if you want to do TNR. You're going to get the mom cats who have been giving birth, and those kittens are ending up at the shelter. You're going to see reduction in intake like no one's business, but that's how you have to do it. You can't just TNR anywhere. Long Beach Animal Care Services was ready for a change. Between 2005 and 2013, their live release rate was trending up, but they were ready to make a bigger impact and save more lives, and you can see from over the years. In March of 2014, we got started. There was a lot of planning before we began, and this is 2000. We probably started our meetings in 2013, and this was all new, and people thought we were nuts. So there was a lot of meetings and a lot of me pushing. Let's go, let's go, let's start. So Stray Cat Alliance in Long Beach met for 6 months before we were able to launch. Once the program launched, we worked in partnership for 7 years. We have seen tremendous results since partnering in 2014. I'd like to introduce Stacey Daines, who's the director of now Long Beach Animal Care Services for the last, I think, 3 years. And she'll expand more on the impact that this type of program not only has on saving the lives of the cats in your shelter, the quality of life of the cats and your staff, which I think they often get overlooked. The things that shelter staff are asked to do, I think sometimes just borders on cruelty for the people as well. And these kind of programs really alleviate that and make shelters, a life-saving center where people can feel really good about what they're doing. So Stacey, take it away.
Thank you, Christi, and so great to be here today with the Community Cats podcast. We often have staff attend these presentations. They are so helpful. Even though we've been doing Return to Home program for 7 years, there's always more to learn and there's always more to understand. So I'm really happy to be here. So one of the things that we have noticed over, the last decade or so, so that sort of straddles the time before Stray Cat Alliance and after Stray Cat Alliance started our partnership, is that intake has been driven down significantly. And we believe that that is happening for a few reasons, but in no small part due to the significantly reduced birth rates of kittens in certain areas. So we always, I think, feel in sheltering that, this year is worse than the last. But when we take a more, that 30,000 foot view, we actually see that's not necessarily the case. And we see that the areas where there have been targeted TNR, those particular areas have the best results by far of lowering the intake into the shelter. And that's one of the reasons why this partnership has been so important, is that was a big program, or that was a big aspect of the program, is that not only would animals come in to the shelter, and not only would they have their surgery and be returned back to where they were where they came from, so they would be returned to home. But Stray Cat Alliance would use the data of the incoming animals to target their TNR efforts. So instead of just responding to people saying, hey, I've got cats here and I need some help, which they certainly do, they would look at what are the most impacted areas and how do we deploy a team of people into those areas to do high volume trapping so that a lot of spay neuter can happen. So that is a really important part of this program. And what that work did, this is sort of some of the magic, right? The magic sauce, I call it, with this program, is when you have this public-private partnership, you sort of have this ambassador or this liaison who can go into the community, not just representing their organization, but a program that is being run between a city and the organization, and they can activate or relieve a community of what's sort of happening in their area. So a person who's bringing cats in for years and years and years, they'll do one of two things, right? They will either be activated and they will expand their trapping efforts and become more involved in their neighborhood or community because they feel they have a safety network in place. They have some support. It also provides a great community engagement opportunity between the shelter and the community as a whole, because the original community member is now empowered to better educate and advocate for cats. They're not doing sort of this super secret work that the city frowns upon, or which has historically been the way that animal control and cat organizations have not worked together. The other thing that this can do, so if a community member may not be activated, what then happens is that they can be relieved. They can be relieved by the fact that no more kittens are being born there, so there is no longer a sense that they have to constantly trap animals. We know that that is not always the case in certain areas, but they definitely feel reassured that if they do happen to see a cat or they do happen to see a kitten that hasn't yet been spayed or neutered, they'll know what to do. It won't feel like this endless job that they sort of have to do for ever and ever. They no longer feel helpless in their situation. And those two things, the activation and the relief provided to the community, are so psychologically important to their sense of safety and well-being that we see far more animals being spayed and neutered outside of the shelter framework than coming in as stray animals. So return to home programs provide these opportunities and resources for people who want to help. With these programs in place, shelter staff, they become better shelter staff. Veterinarians are no longer relegated to sort of this responsibility of culling an animal population. Animal care staff have less animals in a shelter to care for, so they get to spend more time with their hands on animals and looking at their specific needs and meeting those needs. Officers get to provide real resources to people and answer questions about how those community members can contribute better to the situation for themselves and for their community. What you can see here is that the intake is it's going down and it keeps going down. We are probably in 2021, we probably will not take in 3,000 animals, which will be a completely new experience for our shelter. Since the beginning of our partnership, intake has decreased almost 50%. I think it's 47.5%. And since we've partnered, euthanasia has decreased by over 90%. And in 10 years, euthanasia has dropped 95%. In 2020, we were able to achieve an overall live release rate at our shelter of 98% for all animals and 97% for cats. And this is absolutely because of the partnership with Stray Cat Alliance. Without that partnership, this result would not have been possible.
Sorry.
Yeah,
Though
I think it's you.
we now had a partnership, it was not easy. Trust had to be built, and there were many, many challenges. Some of the challenges we encountered were that the program was ran as an internal pilot for the first year and a half. Since the program was untested and rare, there was a delay in announcing the program publicly, which made things a little bit dicey and challenging. The reason for this, though, was that both organizations recognized the concept was entirely uncharted territory, and we wanted to hone the process. There were initial fears that complaint calls would increase, that there would be a huge increase in dead animal calls, and just so many unknown factors. As with anything new, there were lots of growing pains and processes to figure out. Naturally, there are cultural differences between shelters and rescues, which can cause a lot of clashing. Though a lot of planning was done, there wasn't enough time allowed for shelter or rescue staff to really understand the program and come together before the program launched. There was initial resistance from the shelter staff to a rescue coming on board to implement and run a program there at the shelter. Many staff members didn't approve of return to home for various reasons. The process and program wasn't well explained, and the shelter staff was left in the dark. Traditionally, animal control officers are trained that all outdoor animals need to be sheltered indoors, so they thought return to home was abandonment. They didn't get the chance to understand that there was a better way. Those who disapproved worked very hard to sabotage the program. Cats would be moved from the feral room to the adoption room without letting anyone know. If the cat didn't get adopted, they were euthanized instead of being returned. We faced challenges with the on-site medical team, whose prior policy was to put down any cats with ringworm, mange, or minor illness. Trying to reconcile the prior policy with the current practice was challenging. Due to the cultural differences, it was a challenge to come to an agreement on criteria for releasing, which is a really, really important aspect of any time that you're going to start a program. That criteria for releasing is probably the most instrumental thing you can do together with your partnership. It is Stray Cat Alliance's policy to return to home cats regardless of temperament and behavior, based on other criteria if there is no live outcome at the shelter. It took 2 years of working together for the shelters to see the benefits of these criteria. Outside of the partnership bubble, there were many community concerns that needed to be addressed. Community members were concerned about fleas, defecation, and of course, kittens and kitten deaths. Stray Cat Alliance worked with the shelter, city council members, and other rescue organizations in the direct community engagement, answering these service calls to address these concerns and educate the public. Additionally, both organizations provided information through large and small town halls, small direct council meetings, and grassroots in-home meetings with neighbors. Stray Cat Alliance staff also went out on field calls with the officers. We learned from the officers, and the officers learned from us, and that was a critical move that we made into the second year. There were also political concerns. We were afraid City Council, code enforcement, and vector control were not knowledgeable enough on RTF, thusly conveying incorrect information to the public. Again, engaging via town halls and council meetings did much to alleviate these concerns. Change is hard, but with persistence, we overcame the challenges to run a very successful return to home program.
So making it work. You can see that it takes a lot to make these programs work. They don't happen, all of a sudden. But Stacey will talk a little bit about what we've learned in our 7 years as partners.
So communication is hard. It's one of the hardest, I think, parts of any work that we do. Sometimes it feels like we can just never communicate enough, and then even when you have communicated, you don't even know until after the fact that, oh gosh, maybe that wasn't enough communication. So we learned that it is imperative that everybody communicates early, and often. You just cannot assume that everyone is on the same page. I think as a person in leadership, if I could give advice to anybody else in leadership, is that we have to understand that there is going to be discomfort and pushback whenever you're changing a system, and that we should find space to be comfortable with that. If everybody was fine with it, it's probably not enough change. And when we are in a system where so many of our cats were dying because they had the unfortunate experience of going to the shelter, there's going to be some disruption in changing that paradigm. So discomfort should not just be tolerated, it should be sought out. There should be frequent mandatory meetings to ensure everyone really understands. You know, if we tell people we're going to have this meeting, go ahead and come if you want, that is not enough. People need to understand what their roles and responsibilities are and what the expectations are. If we make, you know, shifts and changes sound optional, then they become optional, and change is absolutely hampered. We've also learned it is important to let staff in, to be open and accessible. We have to create a safe space for discussion, not just say, well, this is what we're doing, so get used to it. It's important to allow time for all parties to grieve the changes and acclimate to a new system. I think that we don't understand that sometimes as the drivers of change. We don't often experience a lot of change that we have not chosen. And so we don't experience the same sort of grief or letting go process that other people do. These are their jobs that they're used to, that they're familiar with, they know how to do, and they've spent a lot of time in their career cultivating their body of knowledge. And so change means an outsider coming in and plucking away at that carefully curated body of knowledge and basically looking at it and saying, well, this piece of knowledge is garbage, so we're going to get rid of it. Well, the staff member has a lot of pride in what they did to achieve that knowledge. And so there is going to be a grieving process, and we have to allow and encourage that grieving process to go through the cycle so that they can move into the change. And to consider the opportunities where staff, and I think this is probably the best part of getting to the end of the grieving cycle for staff, is to find opportunities where staff from both of the agencies can ride alongside with each other to see the other side of the processes. It helps get the person out of their own sense of their own change to see how the whole thing works together. And that's where the buy-in starts to happen. Anna?
Yeah, I would completely agree with you, Stacey, on the two teams working together. As I stated in my earlier part of the presentation, in the second year when we started going out on the calls, the tougher calls with your officers, that's where everything started coming together. You know, a few officers started really trusting us more because they saw we knew what we were doing, and we trusted them. We saw that they really did want to try to make some changes. So that is a super valuable point you made. We also learned that the medical team must be on board. The medical team is your most important ally and imperative to the success of the program. They must understand and buy into the program, or you will not succeed. As we mentioned, when we started the program, the medical teams felt they needed to euthanize every community cat with any issues. Mange, ringworm, or other minor issues are fixed now and treated. We've learned even some bigger issues that Long Beach kind of took on themselves, and their staff veterinarian said, I think this cat can go out. Let's try to fix it. And it's worked. And that was one of the great things, is kind of giving the veterinarian staff, the medical staff, some buy-in and some decision-making, and they flew with it. We've learned on-site spay and neuter service is a lifesaver, both to cats and the program. This helps to keep the shelter in the loop versus feeling like outsiders when the rescue comes to take cats to spay and neuter. Additionally, it's more efficient as the rescue isn't needing to transport cats all around the city to different veterinarians. We've learned that accurate data is critical, especially kitten data. As intake numbers come down, it shows a direct correlation to the program working. As the years go by, we should see less older kittens coming in. We can't see that without properly gathered data, including age breakouts for both live release and euthanasia. Data also tells us where to concentrate targeted TNR. Data helps show what resources are necessary and how programs may need to pivot. To help facilitate information gathering, we helped develop a simple intake form which allows the intake staff to have more fruitful conversations with the community, thus getting better information for the team to decide what's the best live release avenue for the cat. We knew and we reaffirmed that alternatives to return to home must be considered. Going in, we knew not every cat would be returned. Alternatives like adoption, working cat programs, along with kitty boot camps needed to be on the table. The form we created helped us make informed decisions about the safest placement for the cat. We've also learned you must educate and build relationships within the community you are serving. We explain the process to the public and work to get their support. A partnership like this shows city acceptance. Many people think cats will get adopted from the shelter if they're turned in. We explain that that is not the reality and that Return Home is a sanctioned citywide program. Most people accept the cats now and understand the process. We provide resources, door hangers, deterrent brochures to help educate the community. Stacey?
Great, thank you. So Stray Cat Alliance helped create these resources, which are also provided to our animal control officers who have them in their trucks to distribute to the community. And these resources become performance metrics for field officers. Instead of using arbitrary sort of metrics, things like, historically, the way that officer performance would be rated would be how many citations were issued by the officer, how many calls were cleared by the officer, how many impounds were done by the officer. So this provides a better metric to say how many spay-neuter vouchers were handed out, how many door hangers or how many information brochures were given. And this instead helps the officer really strive to do the good work of supporting the community and having a way to measure that and to say, look at this great work that you have done, as opposed to other metrics that may not be beneficial for the animals. Anna.
As mentioned, these are the educational materials for community and staff that we spoke of. On the left are the community cat door hangers we hang prior to or after releasing. You'll notice we have information in English and Spanish, and it's important to know the community that you're serving and that you can reach out to them in their native tongue. You're going to have a lot more buy-in from that community if you go to them rather than expecting them to come to you. Having materials in English in the languages of the community you are serving increases engagement, as I just said. On the right is our brochure about living with community cats and deterrent ideas.
So something that Anna had mentioned was that we had worked together to really find, how we can get the best information from people who are bringing in cats. And this information is gathered by people that are at the shelter accepting animals over the counter, as well as officers. My experience has been in sheltering that it feels in the moment a lot easier for somebody who is helping somebody take in an animal over the counter to just sort of get them in, get them out on their way. Sometimes forms aren't even signed. And what we found is that the value of having that one-on-one conversation and engagement is just, it's life-changing for every single person that participates in that exchange. It's life-changing for the animal. It is life-changing for the front office staff person. It is life-changing for the resident or the citizen that's bringing in the animal. So this is our animal intake form, and it was developed between our animal care, or I'm sorry, our front office team, as well as Anna Wong. She worked directly in the front office, I think for probably, 2 to 4 months, right, Anna? And just sort of worked with the staff, hearing the conversations that they were having, to really sort of put this form together to make sure we were capturing the right data so we could make good decisions for the animals. And this data helps determine criteria. It helps build data, it empowers the shelter intake workers, and it builds community trust. The prior form that we used, it was like a quarter sheet. It didn't get any information, really, just sort of a name, the person's address, their signature, maybe a date. But this is now just sort of the one form that we used, and really having Anna work in the front office with our staff in sort of a consultative role helped them sort of see their blind spots that they had when it came to interacting with the community. So now it's just this one form. It's the only form we use for every single animal coming into the shelter, whether it's a surrender, whether the animal is alive or deceased, whether it's a wild animal, and we get all the information that we need. Anna.
And I want to kind of touch a little bit on the importance of learning from other people. I've been privileged to have Christi Metropole as my direct boss. And as I was developing this form and working out the strategies of engaging with the front desk and finding out the best way to do the intake, I was very fortunate that I could go to her and bounce ideas off of her. She has years more experience on me, and I would encourage all of you, if you're the top in your organization, find somebody else that has the experience above you. We always can learn from each other, and I think that's one of the biggest takeaways for me, is to not be afraid to go to someone else and say, hey, what do you think about this? Because this form couldn't have come into fruition without Christi's experience. Well, Christi wasn't physically there. Christi did help develop this form. And so don't be afraid to reach out to other people and make sure you're doing something right, because in the end, this is about an animal's life. So this does empower the front desk staff to get more detailed information and to get proper data, which again is the most important thing that we need when we are releasing these cats.
Absolutely. And, return to home programs and these public-private partnerships, they only really work for shelters that need and want real change in their communities and in the lives of their community cats. When we first started this program in San Jose, we were extremely fearful. We were terrified. We just didn't know what was going to happen. There wasn't another organization out there who had done it that could help us. We were just sort of doing it on our own. And so I cannot impress upon all of you here today that if you are feeling that fear, if you are feeling the fear of someone is going to sue us, you feel the fear that a council member or a county supervisor is, going to go off the rails. Our complaint calls are going to increase. Animals are going to suffer. Those are all fears that we have when this happens. Our organization isn't going to be able to handle it. I will tell you, I have been there. I have done it. I know exactly where you're at, and what all the biggest piece of advice that I can give you is that you need to feel that fear and you need to do it anyway, because those fears evaporate. They are not legitimate fears. They're real, but they're not legitimate, and they don't necessarily come to fruition. You might have a complaint. You might have something might go wrong, but what you will have are, depending on the size of your organization, hundreds and thousands of cats living their best life. So that's what I just would tell you, is you got to feel that fear and you just got to do it anyway. So what does it mean really to be partners? Well, for a return to home program to be successful, you have to have a partner that can be trusted. You are a team. So trying to perform, under a microscope is brutal, and you have to have each other's back. And that can be hard to find depending on your community, depending on the culture of rescue. I know the culture of rescue in Southern California is very different than the culture of rescue in Northern California. But what I can tell you is that there are organizations out there who want to help you. They want to make you, they want to hold you up, and they want to help you save animals. And they are not just drawing you near to stab you in the back, but there are some that are. And so it's up to you to really know who those people are. So when you are going to really partner with someone, you've got to make an alliance, not an allowance. And I think that when we make these alliances, we get confused with making allowances. And an allowance sort of looks like, well, I'll do this if you do this, or you can't do that because I need to do that. Those are allowances. That's not an alliance. So an alliance says, I'll do this so you can do this. I'll do that so that you don't have to do that. Those are what alliances are. And so making sure that each organization can support its mission and be supportive of each other's mission. You don't necessarily have to adopt the other ones. Having that rescue partner, it really benefits the shelter because it allows us, the shelter, to be better inserted into the community, to really know what's going on. Seeing public officers can cause a lot of anxiety in community members, but having the support of a rescue will soften the presence of an officer at a call. Rescues also provide a level of problem solving in your community before law enforcement or punishment or any punitive measures need to be involved or taken. And that is really critical for building trust in your community. This partnership and the program, it helps the people in our community. It doesn't just help the animals. Rescue partners help you build that bridge to other groups who may be against your shelter. And because of the work of Stray Cat Alliance, because what they have done in our community and the way that they've engaged our community and partnered with them and have brought us together with community members and worked so closely within our operation, they have an understanding of shelter situations, and they can more accurately give information to community members about what's really happening in the shelter, and they have our back. They're supportive. Christi.
Yeah, this kind of type of partnership and program is beneficial for rescue organizations as well, because it expands the communities we're able to serve. We're just able to help more. It provides a broader understanding on how to provide animal welfare in our cities. It creates more advocates, which is the best, and it helps work for the best ethical outcomes. I also know that of the people on this webinar, you might not all be in a municipal shelter, or you may be in a private shelter, or you may be a rescue organization. I would encourage anybody who works in a rescue organization to reach out to your local open intake shelter to support them. Your work married with their work is going to have the best outcome. When we've done this presentation, it's been a lot for shelters, so I really want rescue organizations and independent rescuers to really know this is for you too. This is for you to become involved and support your shelter. And I know it's not always easy, but it's the best kind of work because the alchemy of the two, you get the best outcomes. There's no question about it. Stacey?
Absolutely, Christi. This becomes a program that both of you sort of understand. It could not have happened without the other. We could not be where we are today without Stray Cat Alliance, and Stray Cat Alliance likely wouldn't have had the resources to have the same type of impact in our community without our partnership. So we become sort of this coalesced entity. And these programs, these return to home programs, they really allow that public organization to share the load to save more lives. It allows the private organization to educate more people to save more lives. And this program and the partnership, it's a door. It's an important door that all of us are going to encounter in one way or another in our experience in animal welfare. We're going to get to that door and we're going to have to walk through it, or we're going to have to choose not to walk through it. And it is the door that gets your community to its next place. If you don't walk through that door, you will not get to where you want to be in the time frame that you want to be there. I talked a little bit about fear, and I talked a little bit about, just feel the fear and do it anyway. And we did that. We do that over and over at Long Beach. We did that in San Jose when we were starting the program. And anytime, really and truly, anytime we've made these moves, the only regret that we have is that we didn't do it sooner, because in our rearview mirror are the lives that were lost, the people that weren't engaged with, and all the opportunities missed. That is all that's in our rearview mirror. And so I would encourage you, feel that fear and do it anyway. And the only regret that you will have is that you did not do it sooner.
So thank you everyone for your time today, and we are here for questions.
And thank you very, very much. Excellent information. I do have some questions, and I'm sure more questions will pop up. So one question we have here is probably for Stacey. How much resistance from the public is there for supplying a fixed address during intake? I have found as a returner of kitties for my local shelter that a difficult part of doing a return is the lack of knowledge that you're returning a kitty to its actual home. Whoops, just lost, there she is.
I was picking buttons. So there hasn't been a huge amount of resistance. One of the, I think the question that's being asked is probably from a private rescuer. And I know that there is sort of this resistance on the part of a public agency to give a member of the public an address that they were provided with by some other person. We have gotten over that by knowing that addresses are public records. For goodness sakes, you drive down the streets and they're posted on every single house. So what we don't do is we don't give the name of the person that lives there or any identifying information. So that a cat came from a location is absolutely a matter of public record. And in addition, the shelter, because we are a government agency, we require people to give us truthful information. So we want to know exactly where animals are coming from. We also require them to verify who they are and show their government issued photo ID. So as a government agency, we have the authority to do that. If someone is coming to a government agency to request services, they are required, if that agency so chooses, to verify who they are. So we do that in support of the animal, but it isn't necessary to have the literal exact address where an animal comes from to make a good return. So I think it's important for people to know that. But if you can get it, oh, best to get it.
And if I could elaborate, I'm sorry, can I elaborate a little bit? One of the things we also noticed as we were working with the intake staff, providing a form that requires conversation gets us the correct information, because we would be up there and on the form it states very clearly, this cat could be adopted, this cat could be returned back to where it came from. Are you interested in adopting this cat? So there's a lot of stuff on the form for these people to be engaged with. And so as you're questioning these people and talking to them off of the form, you can tell when someone's getting nervous, because most people don't want to abandon the cat. They're bringing the cat to the shelter because they want to do what they think is best for the cat. So when they start feeling a little bit of the heat about, oh my gosh, and I'm thinking of laundromats, because believe it or not, in Long Beach, people say they find a lot of cats at laundromats. That was actually our biggest challenge, was laundromats, interestingly enough. And never did a cat come from a laundromat, and the cat never got released at a laundromat. We either got the correct address, or it was the person's cat, or they said they found the cat elsewhere and it wasn't from that city. So again, and that was done with not a lot of high drama. It just happened naturally because we went at it with the attitude, and this is something Christi taught me, go at it thinking these people really want the best for the animal. And if we do that, and we taught the staff that, they respond, the community responded much better. So we got good addresses.
When you are doing your TNR programs, are you releasing the cats during the daytime, nighttime? What is the process that you use when you return your cats?
Are you talking TNR or RTF? TNR?
Either way.
Okay. RTF,
What'd you call it?
I did it wrong. See, even me, who's been in this a long time, is having to be reminded to change the name. Return to home, and it is vitally important we call it return to home, because that is exactly what it is. So forgive me. So anyway, return to home, we were releasing mostly in the daytime because we did it on shelter hours. There were 2 summers that we chose to release some cats at night, just based on the area. It was very, very hot, and one of the things that we were noticing is that releasing in the day was not the best thing for that cat in that kind of heat. So we kind of took it during the summer, never in the winter because we are mild here, took it case by case, but we did it based on shelter operations. TNR, it would depend on again, were we doing the trapping? Was a community member doing the trapping? Because again, we always want to engage the community member to do it and do the release. They're the ones taking care of the cat, you know? But of course, we would teach them what was best protocols. I am going to speak on behalf of myself, not Stray Cat Alliance, for just 1 second. I used to be of the mindset it's always at night, safest for the cat, and I do still hold that to some extent, but I have also found that releasing midday is not a bad thing either. It's very quiet a lot of the times. In Long Beach, we're fortunate we have a lot of alleys, so there were a lot of alleys behind the houses, so we had a lot of safe release areas as compared to another RTH program that we ran. It wasn't a lot of alleys, and we had a lot of big streets, and we had to be very careful in how we did the releases, and that was one that we had to give a lot more thought to, time frames of when we release. So in a nutshell, I don't have a hard and fast answer to that. Christi has some opinions too that I'm sure she could elaborate on with regards to release time as well.
My philosophy with TNR is you release them the time of day you trapped them, because traffic patterns change, everything changes with the day, and if they were out at that time, they knew the traffic patterns or the feeding patterns, then you release them if you can, if it's even in the morning. That's really what I've always done. If possible, with a cat you've pulled from the shelter, you don't know what time they were trapped, so you do have to be very intuitive and observant about, all those things, because they bolt. You want them to go this way and they go back that way. The other thing I just wanted to pop in before we're done is that for a very long time, I was very frustrated. I'm on a lot of committees that we call this returning cats from the shelter, all these different things. And return to field, and as I said earlier, shelter neuter return. And when you tell the public, they are thoroughly confused. Even in our own movement, everyone's thoroughly confused. And I actually called Dr. Hurley and I said, I need your buy-in on this. Dr. Kate Hurley from UC Davis, who I adore. And I said, I need your buy-in. I want us to uniformly call it return to home for community cats, because I'm tired of the dogs getting the return to home, the owned cats and like, what about the cats? And politically, it's better. It's an easier pill to swallow. It explains more. And she was like, let's do it. So we've really been on the bandwagon to unify the language, not only because we're a movement that has non-unified language, but also it really changes the perception of what we're doing. Shelter neuter return is completely confusing to people. Return to field sounds like we're throwing them out in a field to fend for themselves and starve to death or get eaten by a coyote. But return to home is, in its best practice, is exactly what we're doing. So that's why I always tease everyone when they say something else. I'm like, what is it called?
Yeah. But and if I could reiterate, as the person who's returning the cats, since we've been using return to home, Christi, what has it been, about 9 months now, 10 months that we've really been doing it? It has really made a change in how people perceive it. So we run a program in Garden Grove, and when we explain the return to home, or the officers explaining return to home, like Christi said, it makes a world of difference as compared to when we were using RTF and SNR. So we've been through 3 different ones, and I can tell you unequivocally, return to home has been absolutely the best received and the simplest understanding.
And I'm on some of the committees for HOS, if people know, human animal support system, and I got buy-in from all those people, and I was just so excited. So I feel like maybe by next year we'll all be on the same page. Some really influential cat people. It's awesome.
My last question for you, it looked like Michelson Found Animals was part of this, at least the pilot program, I'm not sure. Was that the key funding source, or how did funding work for all of this?
Yeah, so Amy Gilbreth, who was with them, she and I were on the committee for the white paper in 2010 or 11, and we were learning about, like, through John Cicerelli and Kate Hurley and Jennifer Scarlett, like, these, it was just starting, it was in its infancy. And after a year of doing that in the white paper and all the controversy, Amy came to me and said, we'd like to fund something like this. What do you think, in Southern California? Because there was only San Jose, and I think there was maybe in Florida. Maybe that was it, in Jacksonville. I don't know if Best Friends had started yet. So no, they hadn't. So we went up there and we learned, but Michelson Found Animals paid for most of it the entire 7 years, and we were only going to do it 5, but we kept extending it because we were getting better and better and refining. And the last year was really handing it back to the shelter for them to be able to do it themselves. And I will say, with a shelter director of the caliber of Staycee, I know it's in good hands, because Stacey's the best.
Well, Stacey's got the cat ears.
She does.
We can't have a conversation like this without mentioning she's the best dressed today, for sure.
Yeah, so Michelson Found Animals was instrumental in it being born and it being, growing up and everything. They're amazing organization, foundation, amazing.
So one of the things we have to look at is capacity, the ability to have financial capacity for a pilot program, something you might pitch to a community foundation on a smaller scale, something local, get the human services component involved to try and access some funders sort of outside of the box, because we all can't go to the same funders. We're all not going to be able to get that kind of money. So we have to think about some other resources. But
I wonder, Stacey, Daines, if we did like a little study on how much money the city of Long Beach saved by having so much less intake. Like, I always think, like, let's just reallocate. Now they're reallocating, right? They're not spending on time on ending the lives, and just holding these cats is very stressful on everyone. And now, you know, you're reallocating those funds elsewhere.
Yeah, and I just want to just talk a little, and I have to also point out that one of my cat ears is tipped. So
Right.
Anyway, but in terms of the funding, and I mean, there's a few aspects of this that coalesce. So Anna had mentioned that, you know, the veterinarians are now treating animals for the minor things that they were euthanizing for previously. I just want to say that it's gone even so far beyond that. We were at a stage where we were considering, or we were at that space in these programs where you say, okay, feral cats or cats that come in, stray cats that don't have any real place to go, that have lots of medical issues and they're not friendly enough for adoption. We're not going to invest medically in those animals. You know, everybody felt comfortable with euthanasia of those animals, and we're past that now to where the cat's coming in, regardless of its temperament, if it's treatable, it gets treatment. We have a cat right now. If anybody would like to message me later, it is a feral cat. It really is truly feral. Her name's Petunia, and she has 3 legs and needs a nice place to go. So if anybody knows of a nice place for Petunia to go, let me know. And she's been with us for about a year. So it just shows you the difference of what we can do for animals when we walk through that door. You walk through that door and your world of life saving is opened completely. We had Vinny, a cat, $10,000 cat for cancer, that your city shelter for the city of Long Beach, a city shelter, supported that cat, worked with the community to get donors to help fund him, and he's cured and he's in his forever home. So
he's in his forever home with one of your lieutenants.
Yes, with one of our staff. So when you do these programs, it is not just about life saving. It is about building your strength to life save. This is the work that we do to strengthen who we are as organizations, to reach farther and to do better for animals. So so in terms of the cost, yeah, we've reallocated for sure.
Great, excellent. Well, I want to thank all 3 of you for a great panel presentation.